Good afternoon, everyone. How are we doing today? My name is Travis Horne, and thank you so much for being here with us for our Managing Stress and Workplace Burnout. And for this webinar today, it'll be myself, and for those that know me, and a lot of you may, I work with Borislow Insurance and been here for a good 8 years. And these are some of the things that we like to talk about because right now, with May being Mental Health Awareness Month, this is a very important topic. And so what we did was today, I'm going to talk a little bit about mental health awareness, as well as how to manage stress, work on burnout. And then I'm going to turn it over to two guest speakers we have today, which is Shore Salter and Molly Marshall. They are with the Modern Health Group, and they have an innovative approach to how to work through burnout within the workplace and managing stress. And we thought it'd be a great opportunity to bring them in to showcase something they have available, as well as some actionable items that we're going to showcase at the end, or at least be able to provide to you as a follow-up. So again, thank you very much for the next 30 minutes. If you have any questions, feel free to put them in the chat. We'll answer those as they come up, and at the end, we'll have a little Q&A so we can talk through some questions you might have for myself, Shores, or Molly. So again, thank you very much. And without further ado, let's talk through what burnout is. This is kind of what we're going to be talking about today. A big piece of what's happening in the market and in the industry today is a lot more people work from home. There's a lot more people that are integrating work-life balance. And what does that really mean, right? And how does it affect us from a health perspective? It really is one of those things where we've started to see after the pandemic a big change in the way our work life has affected our personal and social life. And those are things we want to address today and see if there's ways to kind of help yourself personally and professionally to move things in a positive direction. We'll talk about ways to manage your job stress, and then I'll turn it over to Molly and Shores to talk about what they have available. And then again, Q&A towards the end. So first off and foremost, what is burnout? I get this question all the time. My team, myself, we always get this question because it's a word that's thrown around quite a bit, and it has to do with the workplace. It really has to do with how many hours we're spending on the computer. I mean, we're on the computer all the time now for most of us. And, when we're on the computer, are you working at home, and are you with your families at home? And kind of, things that are occurring more and more over time is we've started to integrate what we're doing from a work-life perspective, and it's affecting us not only from a sick day perspective, but also from a chronic conditions perspective. There's plenty of stats out there. There's plenty of statistics that say that, the more we increase our work and we start to burn out, the more sickness that will occur and the more chronic conditions we can see down the road. And so if you're asking yourself the question, what is burnout? Well, it runs into a lot of what you're seeing. And it could be as simple as, if you're not in the office, it could be how many hours you're working. Are you working from the time you wake up to the time you go to bed? Is there any breaks in between? Is there your intensity level of your job? Has that increased over time just because now there's more expectation put on us? And these are things that happen usually over time. It's not something that happens, one day or 2 days. It's something that really occurs as you start to move through your work-life career. And then lastly, and I think the biggest two at the bottom, I put kinds of bullets on there. One really has to do with office politics. Now that we're working from home more, or we have more people work from home, there's more office politics happening than we've ever seen, because we don't know it, we don't see it. And sometimes that can have a big effect on our burnout from a work-life perspective. And then the coworker conflict, which happens in everyday life. And there has to be ways that we can address these things and be able to effectively help ourselves to not get into that place of burnout. So how does it affect us from a stress and a heart health perspective? I just want to put a few things on the table so you could kind of see the different areas that it might affect. And that is, when it comes to burnout, it is about long-term and chronic stress. And as those things start to increase over time, and you start to see more and more of that on your shoulders, there's a negative effect on your heart health. And there are ways that you can address those chronic conditions and those chronic stress. And I'll give some examples of kind of how I do it, and I know others on the call do probably the same thing. But if you're not familiar with it, it's about looking at your habits, your everyday habits. My example is I always I wake up at 6 a.m. in the morning, I jump on the computer, but I have a hard stop. Like I do breaks. Every chance I can, I kind of stop and do a break to make sure I can get off my computer and change those unhealthy habits that can really affect us in the day, as well as what is our eating habits. You know, is there a way to change the eating habits? Because a lot of times eating habits can affect our overall stress and our overall burnout throughout a day. Are we exercising? It's important to me that we do as much as we can to, oh, did I freeze there? I feel like I froze. We're back on. It's important to me that we do a lot of breathing exercises and meditation. I actually use something called the Oculus. And if anybody's ever heard the Oculus, it's a metaverse. It's kind of this gaming thing, but you can actually go into this and do some meditation within the metaverse. So it's very important to be able to have your own way of meditating, or maybe it's through yoga, or maybe it's through regular physical activity, going and taking a good 30 minutes to 45 minutes to do some physical activity to kind of help that stress and that heart health, because over time it can make a chronic condition, which is what we're trying to avoid. And lastly, and the most important piece, I really think is becoming more and more prevalent with all of us today, is being able to ask for help. Mental health was something that was never talked about in the past. No one ever talked about it. We didn't want to say the words, but now today it's really become a big part of the work life that we're in. And you know, there are plenty of tools and resources. You have benefits yourselves to be able to talk about mental health, and the more you can ask for help and get help in certain ways, the better off you'll be. So lastly, before I turn it over to Molly and Shores, I wanted to hit on some ways to manage your job stress. I feel like this is something that I'm really good at, and so I like to share it with all the folks that I talk with. And when I do these types of presentations, it's important to really put it on the table. And there's 7 of them. I live by these, and I think a lot of people that practice mental health awareness and taking care of their mental stress, these are the things that they really focus on that can help us to manage those things. And one is planning and priorities. Believe it or not, I have a list that's sitting right next to me where I plan and I do my priorities every day, making sure that I have my A, B's, and C's. When I was younger, and I'm going to date myself right now, but when I was younger in the 20s, they had this little book. It was a book you would open, and it would tell you in the book you'd have to do a 1A, and the priorities you'd want to do. And it was a great book because it kept you on task. And you know, for those of you that have a lot of things going on in your life, work and life, it's good to have those priorities and be able to plan and prioritize those things you have in the day. Slowing down. We only have more and more work on our shoulders today. Everyone has been given more work to do, and guess what? There's just not more time in your life. So the only way to really manage it is to manage what you can manage at the moment in time, and that's by slowing down, doing one task at a time, trying not to do 3. I always tell my team, I have 3 screens. I know a lot of people think, wow, that's crazy. Why would you have 3 screens? I love 3 screens, but I only look at one at a time to make sure I can, you know, kind of manage my task list and what I'm doing. So slowing down is important. Focusing on what you can control. This is where a lot of people get in trouble, in the sense that if you try to control the things that you can't control, they will go out of control. So kind of slimming down how you control your own control is a best tactic in order to help yourself from a stress level perspective and a burnout perspective. Using all your benefits, you know, we in the Borislow Insurance, you know, and we are in a place where we work with all the medical carriers. We work with several other ancillary products, you know, maybe like short-term disability, long-term disability, which you all are aware of. And there's several things out there that are available that we maybe don't even know about, like an EAP, an employee assistance program. So from a brokerage perspective, it's our job to help your employers to have those benefits available. If you go into your medical carrier, whatever it may be, a Cigna, a Blue Cross Blue Shield, a United, they all have several things available for benefits, from a mental health perspective to an EAP that can help you to find the right therapist or anybody under the sun that you may need, just to kind of guide you to some assistance, which obviously I've brought 2 folks here to talk through some more resources and tools that are available. Last 3, first one is taking a break, getting up from the computer, taking time, taking a walk. I live in northern New England, so it's bug season. I refuse to go outside right now, but that's okay. I can still, if I'm in the office, we have kind of this trail around the office that you can walk and get some steps in. Just get away from the computer, give yourself time, be able to manage your own time, because if you're always on the computer, that will create the burnout piece that you don't want to do. Separating work from life, very difficult to do because we have our phones, right? Everyone's got their phones in their hands. I have a son who plays baseball, and constantly I'm at the field playing baseball. He's playing baseball, and I'm on my computer and on my phone. I have to remind myself, I'm human like everyone else. I have to remind myself to put my phone in my pocket and be present in the moment. Because if we're not present in the moment, then we're continually bringing ourselves down that path where stress and then chronic conditions can occur because of those type of stress. And then lastly, and I'll turn it over, is limit interruptions. Especially if you work from home, that can be difficult with small children. I have 4 of my own, especially mine are grown, which is always nice. But if you have younger children, that can be very difficult. So find that ways to limit those interruptions, especially when you're doing work, or find the ways to limit those interruptions if you're outside of work and you're not trying to work. And so those are just some basic things that I practice on a regular basis, and important just kind of keep in my everyday life, especially if we're trying to practice mental health awareness, and hopefully that's something that can help you. So without further ado, I'm going to turn it over to Molly and Shores to really just do a quick introduction for themselves and just kind of talk a little bit about what Modern Health brings to the table and how they can better help you and your families. So thank you for being here both. I appreciate it, and the group appreciates it. So Molly, I'll turn it over to you.
Awesome. Thanks, Travis. And just thanks, Borislow. I think it's one thing to know that you should go take a walk or practice meditation, but there's something about someone reminding you to do it, I think is really helpful. And I think, Travis, to your point of really using your benefits, whether you're an employee and you're like, hey, I need some mental health resource, exploring your benefits, asking your HR admin or team if you're a part of that population. Yeah, how can you disseminate more broader information about benefits, knowing that stress, burnout, anxiety, these kind of, I hate to say buzzwords, but they're coming up a lot in the world today. And maybe a great segue into what we're doing at Modern Health. It's probably not a huge surprise, but mental health is just coming up more and more. It's really become table stakes when it comes especially to an organization providing these kinds of benefit offerings, and ultimately having and wanting a productive workforce where employees feel that support and also feel ultimately happy. And I'm sure if you're an employee on this call, you probably agree. So for today's presentation, as much as Shores and I can talk all day, every day, all about Modern Health, we'll do our best to share high-level information on what general trends we're seeing. I think that information helps me as an individual understand, hey, like I'm not alone, or yes, that resonates. So hopefully the same for you. And then we'll also share, just a shift in preferences that we've seen over the last few years being in a global pandemic. And we'll definitely be sure to highlight, especially for HR admin, what you should be looking for when it comes to a mental health solution for employees. And as an employee, and as Travis mentioned, we'll definitely touch on resources available to everyone on this call today as a follow-up. Before we dive in, we did want to quickly introduce ourselves. So Chris, I don't know if you want to shift to the next slide. Perfect. So my name is Molly Marshall. I sit on our partnerships team at Modern Health, which means I have the absolute pleasure to work with the Borislow team supporting consultant relations on that side. I work very closely with my colleague Shores here on our sales and growth team. For timing, I'll do a quick intro to Shores, and then I'll make sure he gets the mic in just a second. Shores supports our groups in what we identify as our mid-market segment, a couple hundred to a few hundred life groups. We work again really, really closely. So feel free to use us both as resources after this call. Cool. Can shift. There we go. So speaking of preference to care, as I mentioned, just really bluntly, what we're finding, especially with research in the space, is that 56% of individuals, so the majority of individuals, are not choosing one-on-one support to start their mental health journey. So what that means, if all these solutions and all the solutions available to you as an employee are triaging you or your employees to one-on-one care right off the bat, we're not capturing the general needs of a population and ultimately not engaging with all kinds of people across an entire spectrum of need. More on the spectrum need to come when I pass it to Shores. But what we're finding really is as being really important for organizations is to offer behavioral health resources that do meet the needs of this entire diverse kind of population that we're seeing. Maybe you even have folks who are sitting overseas or global. And to quickly share how Modern Health is finding success in that kind of a model, we do offer one-on-one support like therapy and coaching, understanding, that is a need for many, but we're also expanding into other modalities of care. Maybe you're an employee on this call and you're like, yeah, I'm not ready to talk to a therapist or a coach one-on-one. That's okay. Maybe there's other resources through benefits you already have. What Modern Health is doing in that space is we have self-guided digital content. What that looks like is podcasts, meditation, courses, whether that's through Modern Health or even just going on a walk and listening to a podcast yourself. We're finding that this is a great modality of care for people who maybe aren't ready, again, to talk face-to-face with someone and need more of a listening ear or to at least engage on their own time. We also are finding a lot of success in offering group sessions. We call them circles. And we find these to be super impactful, especially for people who maybe, again, aren't necessarily ready for that face-to-face interaction, but instead they can choose between an anonymous or more of a discussion-based setting with a group across different topics. As an employee, maybe that's finding a close group of friends or whatever it may be if Modern Health isn't necessarily at your fingertips. And then the last comment I'll make here before I pass it over to Shores, not only do we have many resources for folks to use interchangeably, we also make it really easy for people to access care. We have the capability for someone to book a session with a provider or connect with a provider within a 24-hour window, for example. Or we adaptively triage people to different modalities of care depending on different resources that they're interacting with. Maybe you're engaging with digital content surrounding depression or anxiety. We might recommend you book a session with a therapist or even suggest crisis support resources. So just by looking at mental health in this way, we see really high levels of engagement, 25 to 30% across the 500 or so organizations who have implemented our platform. And I think, again, it just goes to show how important it is for HR teams to select mental health benefits that truly have something for everyone to engage with, or as an employee, understanding what your need is, and then going out and understanding, yeah, maybe I need therapy now, but maybe down the line, I would do best more with a podcast or digital content. With all that being said, I'll pass it over to Shores and he'll be speaking more to the preferences and general trends piece that I mentioned.
Perfect. Yeah, thanks, Molly, for that overview. Hi, everyone. Again, my name is Shores. I sit on our growth team at Modern and have been a part of a handful of different client conversations into Modern with the Borislow team over the last few years. Really excited to spend the next few minutes with you. Molly kind of talked a little bit about some of the solutions that we have in place to support our client partners and members today. What I'm going to spend a little bit of time is really how we overall see the market and our goal of driving engagement for members across all organizations, regardless of background, regardless of position, as well as individual need, really creating that personalization throughout. So when Modern Health was founded back in 2017, we were kind of a product of a lot of different solutions that may be geared specifically towards like individuals who were in those moments of crisis need or reaching out because they're in like, maybe it felt like a desperate state, reaching out for support in that moment in time. Our goal is creating a model that is based on across a spectrum of mental health, where every member, every client of Modern Health would be able to find resources that are relevant to them, depending how their preferences and needs change over time. As humans, we know that things are always coming up personally as well as professionally that are going to influence positively or sometimes, unfortunately, negatively how an individual may feel in that given time. So on this slide, what we do is really kind of paint the picture of how we look to support this spectrum. Crystal, maybe we could just press next real quick. For the sake of this conversation within Modern Health, sorry, we could actually go back. I was just looking to include that quick little highlighted piece. Sorry about that. Perfect, right there. So in the context of this conversation, we're talking about burnout and managing burnout. Unfortunately, what we've seen when we kind of were founded with our belief back in 2017 is that oftentimes members who are in this kind of yellow orange zone are typically those members struggling with burnout, whether it's a relationship change, whether it's a promotion at work while also managing a new family at home, or maybe potentially working in sales, getting towards the end of the quarter where there's expectations and people are trying to meet deadlines. There's a handful of different examples, which I'm sure everyone on this call can have like a personal experience with. In our finding, unfortunately, the way traditional models were set up prior to Modern Health is that there weren't a ton of solutions in place for members within this burnout category to proactively reach within their benefits to seek out that support. So potentially at a risk towards cascading down this area of support towards instances of more clinical need, which are going to highly impact day-to-day functioning for members. So our really ethos is about creating a safe space that takes into account interest, need, as well as personal preference before we recommend personalized care plans to our members, with the idea of making sure that individuals, regardless whether they're in a preventative state and want to take a proactive stance towards their mental health, or maybe going through slight life challenges and are in this yellow zone dealing with instances of burnout, receive the care and the need that they need in a way that feels comfortable for them. So they want to drive engagement with that over time and really create those long-term sustainable strategies to make sure that people feel well equipped to deal with what their mental health might present to them on a day-to-day basis. So again, really just a testament, like one thing that we've seen with Modern Health is over a 5% increase in retention rate amongst our client partners, really gearing towards this yellow zone, specifically with individuals in burnout, seeking out those areas of need in a much more comfortable way rather than being forced into like the one-on-one care model, which Molly already highlighted. We often see as individuals, not everyone's preference of how they want to receive care. And Travis, we can move forward. So just to kind of wrap it all up, I thought it would be helpful to end here just as far as, again, our kind of enrollment process and how we like to hear from members before we lead with recommendations. What I'll end is kind of have some actionable resources that you'll all have access to at the end of the call today within the Modern Health ecosystem. But ultimately, our goal is to drive industry-leading engagement amongst our client partners by taking into account levels of or areas of interest. So when members come into the Modern Health ecosystem, identifying which area of support they're looking to spend time on and working with their care plan. You actually see a handful of these different wellness pillars at the top of the screen here are going to kind of overlap with what Travis went through earlier on in the presentation. Really casting a wide net here really is helpful in getting people to feel comfortable of like the conversations they're having. And then assessing on based off level of need. Again, this is something that we do expect will change and evolve over time. So making it a really intuitive process, so like an app or a desktop view of how people can update their care needs and select different areas of support as needed and as appropriate. And then the third and final is just checking in on overall how people want to receive that care. Really important here because we know that unfortunately, not everyone might, or people are going to have different preferences or different levels of stigma from cultural backgrounds or personal upbringing when it comes to reaching out for support. So casting a wide net here and maybe lower stakes of engagement, like Molly had referenced in those group-based care circles programs or self-paced content, has been a really effective way of how we drive engagement in the platform. And again, take a more proactive stance towards mental health and overall development. So that kind of is that's a really quick snapshot into Modern Health. Obviously happy to field any questions from the group here or after the call. But one thing that Molly and I will do is we'll actually disseminate out to Travis and Crystal, who then they'll in turn send it out to everyone on the call today. Some of our public facing resources specifically within those circles, the group-based care sessions, as well as things like our guided meditations within our digital content library. Really strong ways to get an initial impression of like the effectiveness of the Modern Health ecosystem, and also really provide you some additional resources to kind of deal with some of the things that have been discussed in the call today. So more to come there, and really thank you everyone for listening into our quick overview.
And that's great, Shores. I appreciate that. And Molly, I appreciate your time here today and talking with us. And I'm really looking forward to seeing what we have to offer from an actionable perspective. I think, we usually, as everyone knows on the call, if you've been here before, we'll follow up with an email. You'll kind of get some information about the call, about the webinar, but you'll at least have some actionable items that you can take back with you and help either yourself, your employees, or anyone that might be interested to kind of utilize the services. But I want to thank you all very much for your time. We're going to leave a few minutes we'll kind of hang out here. If you have any questions, please put them in the chat. We're free to answer any. I see some are coming up, so why don't I pull some up so we can go. No, for the most part, there's no questions now. Just kind of end it out. I'll just say thank you to Shores, and I'll thank you to Molly. this was a wonderful presentation and wonderful information, especially in a time when it's Mental Health Awareness Month. For those of you that are being aware of what's going on this month, there are tons of resources out there and tools, and you can come to us, you can come to Modern Health. We have a ton of availability for it. But thank you all very much for being here. And if there's no questions, which I don't see any coming across, I hope you all have a wonderful day and a wonderful Wednesday, and we'll be in touch soon. Thank you.
Thanks, everyone.